Assalamu alaikum, my dear YouTube family, and hello to the world. I hope you all will be enjoying good health. So, today, the topic that I selected from the questions that you ask is how you know. For example, if you haven't visited a doctor and you don't know about the exact age of your baby, how month pregnancy you have, or how much old is your fetal baby. It's a very simple 4 steps, and you may find out about the age. And in gynecology, we call it the gestational age. So, how will you find out about the gestational age? Or the first is the conception dating. The conception dating is actually a process that we know that the normal pregnancy duration uh, post conception is 266 days or 38 weeks roundabout. This is the total duration of pregnancy. But this dating, with the help of which you may find about the age of your fetus, depends on the mother. And you know that the mother, most of women can't identify the conception that accurately, and they might be wrong with this process. So the menstrual dating is much more easy. The menstrual dating is the second process, and because the last menstrual period is more easily identified, you know that when my last menses were finished, you might remember that more accurately as compared to the conception. Uh, Pregnancy duration in most cases is determined here that it is 280 days, around about 40 weeks from the last menstrual period. We assume that if the woman has a 28-day menstrual cycle in which the ovulation occurs on day 14 after the beginning of the LMP. But again, only 10% of the women have 28-day cycle. It will only and only depend on your cycle, how much days of cycle you have. And a normal cycle length can vary from 21 to 35 days, and it will depend on you that how much days your cycle have. The second point and the second category is that the ultrasound dating. The accuracy of ultrasound dating is gestational age dependent. What do I mean by this? That it actually depends on the how much old your fetal baby, your cute baby will be. The ultrasound actually date that. You must visit your doctor for your ultrasound because the earlier ultrasounds are more accurate than the later ones. But your doctor may use the menstrual dates, or your doctor may use the ultrasound dates too. If the difference between the menstrual dates and the ultrasound dates is within the normal range of variation, then he or she will use the menstrual dates. And if the difference between your menstrual dates and the ultrasound dates is outside the normal range of variation, then your doctor would use the ultrasound dates. Another is the Naegele's rule. But the Naegele's rule is actually a rule which is performed by the doctors, that they find out about the exact age of your fetal baby, assuming 28-day cycles. But if a woman has a 28-day cycle and we say that her LMP will be for this process, you must have in mind about your last menstrual period date. If you don't know the last menstrual period date, you are not sure about that, then I might afraid the Naegele's rule might not work for you. It's actually a rule with the help of which you can find out about your expected date of delivery, that your pregnancy will be of this much duration, or you had that much time left for example. That will be your expected diet. So for this, you only have to remember your last menstrual period diet, and then leave it over the doctor, and she will calculate it for you. If you feel any kind of questions regarding your pregnancy and regarding your intercourse problems and your couple problems, you are unable to conceive, or there is any other infections inside your body that you want to be treated about, kindly do share me with me in the inbox. I will check and then I'll reply it to you. God bless you all. That's all for today. Thank you. Allah Hafiz.